Good morning, everyone. My name is Ryan Kruis. I'm the manager of the South Carolina Telehealth Alliance and MUSC's Telehealth Center of Excellence. I'm really excited to be with you all on this virtual conference. I always love the summit. Sad that I don't have the opportunity to meet a lot of you in person this year, but really grateful for the opportunity to do this virtually and really want to congratulate Palmetto Care Connections on such a well done job pulling together this online summit. So today I'm just going to talk to you briefly about some telehealth funding and resource opportunities provided through the South Carolina Telehealth Alliance. Kathy reached out to me wanting to round out the panel and talk about some of the opportunities we have going on in the state, and I'm happy to do that with you. Before doing that, though, I wanted to share a quick slide with you about the SCTA. I think a lot of the folks tuning into this summit are aware of what the South Carolina Telehealth Alliance is. For those who do not, we're funded by the state legislature, and we bring together a number of diverse organizations from across the state really to expand telehealth and build the infrastructure of telehealth in South Carolina. It's administered out of the MUSC Center for Telehealth. We are guided by an advisory council that's led by Kathy Schwarting from Palmetto Care Connections, who's one of our co-chairs, and Dr. Jimmy McElligott from MUSC, our other co-chair. The SCTA has strategic planning process, lots of work groups. We put out reports annually and quarterly on what's happening in telehealth. Encourage you to check that out. And I'll just note that last year we were honored to win the ATA's President Award for Transformation in Healthcare Delivery, largely because of the strong collaboration we have on the state. And you can see on the right-hand side, we work with a lot of folks, and these are not all of them. There are many more involved as well. So we're really grateful to all the partners involved. So moving to some of the resources and funding available through the SCTA, I'm just going to touch briefly on a few quick things, and feel free to ask questions in the chat as we're going through these. I'm happy to send resources or follow up afterwards if you have questions. So the first thing I wanted to note is a new service that the SCTA is providing amidst COVID-19. As many throughout the state were quickly transitioning to telehealth, there was need for telehealth platforms, and there are a number of free platforms out there, but the SCTA worked closely with Doxy.me to create a clinic option to offer statewide free and no cost. Doxy.me offers a version of their platform that is free, but it doesn't include all of the features. And so we have a version available to anyone in the state that wants to use it that includes those premium features like screen sharing, group calls, photo functionality, etc. So there's a request form on our website. I also included it here. Encourage you to reach out if you're interested in that, and happy to talk to you more about that offering. Another resource available to folks in both the funding and consultation space is our program request form, which you can find on our website, link included below. It just asks for some basic information about who you are, who your organization is, and what you're interested in telehealth. And we have some funding available through the legislative funds to fund some equipment for telehealth. We always try to make sure that there's a strong use case in place, and we'll work closely with your telehealth champions to make sure there's a good plan in place. And often we will pilot a project first before scaling it more largely. But this is the place to get started with that process. The other thing I'll note is that we work really closely with our partners like Palmetto Care Connections and some of our other clinical partners like Department of Mental Health and Prisma to make sure that the right folks are involved to help support the project that's getting off the ground. So encourage you, if you are, especially if you're a small or newer to telehealth and interested in getting involved in telehealth in South Carolina, to fill out this form, and we'll get you connected with the resources you need to grow your program. And then another exciting project that we have been doing for a while is our telehealth research pilot grants. In the past, these just have been telehealth pilot grants, and really anyone could apply to pilot a new telehealth idea. A couple of years ago, and I'll just say to date, I think we've funded close to 30, maybe over 30 now, pilot projects in South Carolina through the SCTA funds. A couple of years ago, partly because we had the program request program in place and we were able to fund some of these newer projects that way, we decided to transition this project or this pilot grant program to be much more research focused and to really try to foster the scientific knowledge base of telehealth here in South Carolina, and also try to bring in additional grant dollars in the telehealth research space to help researchers and faculty here in South Carolina to get additional grants to look into telehealth, understand what's working, and identify best practices, and in order to really, like I said, increase the knowledge base around telehealth. So with that, we partnered with the South Carolina Clinical and Translational Research Institute, or SECTOR. They have a number of grant programs for researchers in the state going on already, and including pilot projects for new and young faculty. So they were a great partner, and we've really enjoyed our partnership with them. To date, or currently, the awards are around $25,000 for a one-year pilot project, and we typically will award 3 or 4 a year. Like I said, with this transition over to sector, these grants are now very focused on research and are evaluated as such. We use the NIH criteria when evaluating these projects, and you have to be a faculty member at a South Carolina university or college. At least one person on the grant has to be a faculty member to apply for these grants. The RFAs are typically released in the spring, sometime around February or March, and then there's a process. It's usually a 2 or 3 month process with a few steps, and final awards are usually announced in July. So you can look to early 2021 for the next RFA that will be released, and I've included a link here so that you can look at the 2020 RFA to get a sense of kind of what we're looking for in these grants. On the screen now, I've just kind of noted a few from 2019. We've just awarded the 2020 grants as well, but some of those are still in the process of getting off the ground. So here are some of the 2019. I'll just note that Dr. Kristen Adams and Dr. Claire McGeorge both presented, well, I think Dr. Adams presented a poster at the summit, and Dr. McGeorge presented a breakout session. So you can also tune in to those sessions to learn about some of the research that these grants have supported in the telehealth space. And then finally, those are some of the resources available through the SETA, but I did want to note that there's a lot of federal funding sources out there that Palmetto Care Connections and others in the state have really helped lead and are getting. Some of those involve FCC funds, the USDA RUS DLT funds, which I believe one of my colleagues who is also speaking on this panel is speaking to. HRSA has funds. Increasingly, NIH has research awards available, R01s and such, that can be applied to telehealth research projects. So encourage you to stay informed. Grants.gov is a good spot. HRSA, the Federal Office of Rural Health Policy, has a listserv that they send out once a week that includes lots of funding opportunities around rural health, but a lot of the RFAs included in that are focused on telehealth. Additionally, encourage you to get on our listserv, the SETA listserv, and also the PCC listserv. And there's a number of national listservs too that can help you stay informed, not just about funding opportunities, but also policy and just keeping a pulse on what's happening in telehealth. And then lastly, I'll just note that the telehealth resource centers that are the regional telehealth resource centers, and then one of the national telehealth resource centers, which is the Center for Connected Health Policy, do a great job at offering both technical assistance in getting telehealth programs off the ground, but also keeping a good track of what's happening in the policy space. And that's been especially important amidst COVID to have those resources available. And then this is my last slide. As we know, we're talking about ways to fund our programs through grants and other things, but ultimately one of our big goals is to have, in order for our programs to be sustainable, is to have reimbursement that covers telehealth. And I know this is being talked about in other sessions. One of the things that PCC and SETA are doing is collecting stories from patients and providers around the state around their good and positive experiences with telehealth. as well as encouraging them to sign on to our support statement, identifying certain things that we really want in thinking about telehealth policy as we move forward. A lot of these things are things that have been temporarily allowed amidst COVID, and we're asking that those be continued. So encourage you to share your story and reach out to those within your community and your patient panels and ask them to share their stories as well. Information, you can click on that red cap link to get it. So I know that was a lot. I was asked to keep it short and quick, but please do reach out to me if you have questions. And also, like I said, I'll be in the chat box. So continue to ask questions in the chat box if you have questions there. You can also check out our website. Thanks so much. And thanks again to Palmetto Care Connections for doing such a bang up job with this virtual summit.
Good morning. My name is Shannon Legree, General Field Representative covering North Carolina and South Carolina with USDA Rural Development in our telecommunications program. Today, I'd like to talk to you about rural development and rural utility services and the programs that we have to offer. USDA Rural Development is committed to helping improve the economy and quality of life in rural America. We go about doing these things with one of three different ways: by providing loans, grants, and loan guarantees that support essential services such as housing, economic development, healthcare, first responder services and equipment, water, electric, and telecommunications infrastructure. Rural development itself is divided into three agencies. We have the Rural Utility Service, which I'm a part of, Rural Housing Service, Rural Business and Cooperative Services, and across those three agencies, rural development administers more than 40 programs. Our U.S. electric and telecommunications programs are administered by the national office. RHS and RBS programs are administered by the state and national offices. Here you see the core mission of rural development, and then that is to booster economic opportunity in the rural areas via loans, grants, or loan guarantees. And of course, access to broadband and e-connectivity are a major component of boosting that economic opportunity in rural America. Here are the programs that we offer with our rural broadband. In addition to the four that you see here, we also offer a distance learning and telemedicine program. So these are the four that we offer: telecommunications infrastructure loan program, rural broadband access loan, loan grant, and loan guarantee program, our Community Connect grant program, and our newest program, the Reconnect program. I will touch on all of these programs briefly throughout the presentation. Who can apply for our programs? These are eligible applicants: states, local governments, or an agency of subdivision thereof. You can be a nonprofit and be eligible for the program, or a for-profit corporation, LLC, or even cooperative or mutual organizations. And yes, federally recognized tribes are eligible to make assistance, apply for assistance also. We, however, do not make loans or grants to individuals or partnerships within telecommunications program. There you have our telecommunications infrastructure loan program. On the left-hand side, you see the available funding that we've had for 2018 through 2020. This program is used to finance new and improved telecommunications infrastructure, primarily for the benefit of rural populations in communities of 5,000 or less. The loans may also serve non-rural subscribers in some cases. On the right-hand side, you'll see what we've been able to do and accomplish with this program. Specifically, in fiscal year 2020, we've approved 8 loans for $98.6 million, and that had an impact on 10 states. Currently, we have 5 loans in process for nearly $76 million. Applications for this program can be received year-round, and we must apply via our RD Apply application online system. Here you also see our standard loan term: 2-year principal deferral, interest rate is going to be at the cost of money, and the loan maturity is the life of the facilities plus 3 years. In addition to these loan terms, we also provide assistance and review loan applications prior to submission to the agency. Our next program is the Rural Broadband Access Loan/Grant, and Loan Guarantee Program. Again, on the left side, you see the amounts of available funding. And also, this program can be used to finance the cost of constructing a broadband network. Now you also see what we call broadband speeds, 25/3. That's 25 megabits per second download speed and 3 megabits per second upload speed. We also provide longer terms if you provide a broadband speed of a higher limit. This particular program serves rural communities of 20,000 or less and not in urbanized areas. At least 90% underserved for loan and grants, 50% underserved for loans. And of course, we cannot have 3 or more incumbent service providers within that area. In addition to that, the service area cannot be in a rural utility services previously funded area as well. On the right-hand side, again, additional program updates for this particular program. In 2020, we have not done any loans for this program, and that goes back to the 2018 Farm Bill. That was a revised regulation of the 7 CFR 1738. We've already revised those, made those corrections and so forth, but we're still are not accepting applications currently for this part of our program. Next, we have our Community Connect Grant Program. Available funding in 2019 was $33 million. In fiscal year 2020, it's at $29.1 million available, and we've already awarded 8 grants, but those came out of our 2019 application cycle. Those grant funds can be used for broadband deployment in eligible rural areas. The population requirement is going to be 20,000 or less, and the minimum grant amount is $100,000, while the maximum being up to $3 million. Service area must not have access to broadband services. Minimum broadband service defined as 10 megabits per second, 1 megabit per second upload speed. Minimum broadband grant speed is defined at 25/3, and there is a 15% cash match. Applications are currently now being accepted for our Community Connect program. On the right-hand side of the screen, you'll see with those applications just recently opened last week on September the 24th, and they will close on December the 23rd. That's nearly a 90-day window of application receipt. In 2019, you'll see that we received 62 applications for more than $100 million. And we approved 12 grants for a little over $24.3 million. It affected those states that are highlighted there as well. In FY 2020, we've already approved 8 grants, and again, they came from our 2019 application cycle for a little over $15.7 million. And there you see the states that they're going to impact as well. There's been a slight change with our traditional Community Connect grant program. All applications at this point in time must be submitted electronically on our Community Connect application website. You've got resources that are available to you at the website that is listed here on the screen. And in addition to that, you can also contact our loan origination and approval division at the email address present, as well as the phone number listed below. Next, we have our Reconnect program. This is the newest program within telecommunications. You see the levels of funding from 2018, 19, and 20, respectively. We increased our dollar amount in 2020 due to the CARES Act funding. And we've also gone back and made some significant changes with the program and its application process. For 100% grants, is now 90% of the projected funded service area cannot have sufficient access to broadband. Pre-application expenses incurred for round 1, but benefit and application for round 2 may be funded up to 5% of the total award in round 2. Public notice response period increased from 30 days to 45 days. And here are some updates. In FY 2019, round 1, we received 146 applications for $1.4 billion. 78 applications were requesting 100% grant funding. 53 applications were requesting a combination loan and grant, and 15 applications for 100% loan. We were able to fund 79 projects or nearly $700 million that had an impact on 33 states. Currently, we're in our round 2 of application reviews. We received 172 applications for $1.57 billion. The application window closed on April the 15th of this year, and thus far we have announced 12 projects for $128 million, and that has an impact currently on 9 states. Here you see some additional information about our Reconnect program, the loan, the combination loan and grant, and just the grant itself, the build-out speeds, the terms, the application review, whether it's competitive or non-competitive, the amount of funding that was available for round 1, and then you also see the round 1 application deadlines. We had 3 separate deadlines for loan, combo, and grant in our first round of Reconnect. But moving along forward to our second round, we closed that down to 1. And what we actually did, we actually extended that deadline because it was supposed to close out in March of 2020. So we extended that deadline for another 30 days to April the 15th, giving our clients more opportunity to apply for the program. Next, we have our distance learning and telemedicine program itself, another great program that is available to you. You'll see the available amounts of funding. In FY 2019, almost $38 million for our traditional DLT projects, $26.2 million for opioid DLT in rural areas to help address the opioid epidemic in rural America. In our current fiscal year, we split it into 2 application cycles. Window 1, we received nearly $72 million. That was divided into $12 million for projects that help address opioid epidemic, $9.4 million for projects that address substance use disorder, $50.3 million for all eligible DLT projects. In our round 2 of applications, we received another $24.25 million via the CARES Act. And we also will fund any additional applications potentially from any carryover funds from window 1. There is a 15% matching requirement, and typically this is in the form of cash. The minimum grant amount is $50,000, and the maximum grant amount is $1 million. In 2019, you'll see on the right-hand side what we were able to provide assistance with. 181 applications were received for a little over $58 million. We funded 145 applications for more than $45 million. You see our breakdown of how the award of those awards, whether it's distance learning, telemedicine, the overall still added up to 145. Then also we have STEM and opioid special consideration point projects as well, and how they were funded also. Again, in this current fiscal year, we had 2 rounds of applications. The first round opened up on February the 10th and closed out on April the 10th. All those applications had to be received either via grants.gov or by paper. We received 276 applications for nearly $156 million in requests. Our round 2 applications opened up on April the 14th and closed out on July the 13th. And those applications had to be submitted strictly via grants.gov. During that application cycle, we received 534 applications for more than $252 million. So there's a lot of competition with this program itself. What can you use distance learning and telemedicine for? When it comes to the distance learning, we're looking at real-time interactive delivery of a course curriculum between an educator and the student. It provides educational programs, instruction, or information originating in one area, whether rural or not, to students and teachers who are located in rural areas, or connect teachers and students located in one rural area with teachers and students who are located in a different rural area. Then we also have the telemedicine component. It's supposed to be interactive as well. And it offers the physician and the patient the opportunity to interact with one another also from various locations. There's a great benefit with this program. It saves both the rural resident, reduce travel and expenses. They no longer would have to take off from work and miss work and the pay that goes along with that to go to a doctor's appointment where they can use it via telehealth. Great program that we're offering here. Here you see a map of the United States. Everything shaded in blue, we've got a GFR that can provide you assistance. Even if you're in Alaska or Hawaii, we have someone that can provide assistance to you. Here you also see our administrators, our assistant administrator, Ms. Laurel Leverrier, our deputy administrators, Sean Arner, Peter Amable, Vandal Milheiser, and Kenneth Kuchner. And here you have my contact information, my email address, and my phone number. I thank you for your time, and I now will entertain any questions that you may have via the chat. Thank you.
Good morning, everybody, and welcome to this morning's session on telehealth resources and funding opportunities for the 8th Annual Telehealth Summit of South Carolina. My name is Carlos Mena, and I am the Program Coordinator and Project Officer for the Telehealth Network Grant Program in the Office for Advancement of Telehealth at the Health Resources and Service Administration. So I'm very happy to be here and talking to you all. I will go ahead and talk about what is telehealth, and our office defines it as the use of technologies when distance separates the participants. Here on this slide, there's a more detailed definition for telehealth that we utilize in our official publications. Our office also promotes it as an effective tool for providers to use when treating patients. All 50 states and U.S. territories currently have or have had a HRSA grant to support telehealth activities, and as of last year, there were over 1,300 HRSA awards issued to support activities such as providing direct clinical services, Project ECHO for training purposes, workforce, telehealth equipment, and research type activities. 4 months ago, 1,011 HRSA community health centers responded to a telehealth survey indicating that 51% of all visits were virtual due to the pandemic, and as of late July, it averaged 34% for those same respondents. And before the pandemic, these were some of the major challenges that providers indicated in adopting telehealth. But as many of us are aware, many of these restrictions have loosened as a result of the pandemic, including competitive reimbursement for the use of telehealth. And these are all critical clinical service areas that can be managed through the utilization of telehealth as the lifting of reimbursement restrictions remain hopefully after today. So this next slide here touches on each of our grant programs that our office currently supports. And I'd like to spend some time on this slide in each of these grant programs. I'll start with the first one, the Telehealth Network grant program, and our office began supporting a new cohort with a very specific focus on teleemergency services. Specifically, these recipients, there are 30 of them in this cohort, work towards promoting rural teleemergency services by enhancing telehealth networks to deliver 24-hour emergency department consultation services via telehealth to rural providers without emergency care specialists. Our office intends to publish a new notice of funding opportunity for this program by spring of 2021, and that focus is yet to be determined. The Evidence-Based Telebehavioral Health Network grant is in its third year of a 3-year project period, and it has a twofold purpose. The first is to use telehealth networks to increase access to behavioral healthcare services in rural and frontier communities. And the second is to conduct evaluations of those efforts to establish an evidence base for assessing the effectiveness of telebehavioral healthcare for patients, providers, and payers. And I'll briefly touch on a few resources that HRSA telehealth resource centers have available. The Licensure Portability Grant Program examines and implements strategies for reducing barriers towards practicing telemedicine across state lines, whether through state policies, legislation, and regulations. And OAT also recently began grant support for 2 rural telehealth research centers whose purpose is to conduct and maintain a thorough and comprehensive evaluation of nationwide telehealth investments in rural areas and populations, and conduct clinically informed and policy relevant research to expand the evidence base for rural telehealth services. And lastly, our HRSA's Telehealth Centers of Excellence were tasked with examining the efficacy of telehealth services in rural and urban areas. There are two, and we are pleased that one of them is the Medical University of South Carolina, their respective state, and the other is the sister recipient in our Telehealth Network Grant Program cohort, the University of Mississippi. Both have very successful telehealth programs with a high annual volume of telehealth visits that are financially self-sustaining. So please check back with our office later this year or by early next for any new opportunities, or feel free to visit www.grants.gov, where all of our HRSA's grant opportunities are listed. As I mentioned earlier, our telehealth resource centers are our go-to subject matter experts for anything related to telehealth policy or equipment, and they are tasked with providing technical assistance to any active HRSA grantee on areas such as conducting evaluations to determine the best utilization of telehealth technologies, conducting organizational telehealth assessments, implementing special projects and studies related to telehealth, and selecting technologies, platforms, and purchasing options, and assessing available wireless and broadband strengths. Also understanding telehealth regulations, reimbursement models, and parity laws in states. I highly encourage you to visit their website listed here and select your respective state to access the point of contact information for your respective TRC. In addition, they provide free monthly national webinars and provide presentations at conferences for rural and underserved stakeholders. They also provide the latest COVID-19 telehealth coverage policy updates. So highly worth checking it out if you have a moment. And finally, I'd like to showcase HHS's telehealth website that debuted in the spring of this year, and it has lots of insightful information for both patients and providers. The resources featured on the website are broken out by different topics, and we encourage you to visit the website telehealth.hhs.gov for more information. Here's my contact information if you have any questions. And thank you again for listening to this morning's session. Have a great day.